Stop Paying the Crooks. That's the title of our next guest book. It's a book about fraud, healthcare fraud, yes, stealing your money. According to the author, hundreds of billions of dollars are lost throughout the healthcare system just from fraud alone. Join us live is Jim Frogue, author of Stop Paying the Crooks, Solutions to End the Fraud That Threatens Your Healthcare. How much fraud is there?
These acorn videos everyone's been watching these last couple of days, times that by 1,000, that's how bad the fraud is in healthcare.
Who's committing the fraud?
It is just about everyone. It is so easy to become a Medicare supplier. The mafia is moving in the direction of becoming Medicare suppliers because it's just so easy. It's so easy to make money. Are you seriously
just making that sarcastically, the mafia, or you're saying the mafia?
No, I'm very serious.
You're dead serious?
Absolutely serious. Okay. To the extent that I'm probably going to check under my car on the way home.
Yeah, you better. You probably have some money here. What about the healthcare providers?
Well, healthcare providers can be part of it too, but when you have people that, for example, go to the emergency room 400 times in 2 weeks, or in 2 years, or people that go, take 600 ambulance rides in 3 years, which was a guy out of Buffalo a couple months ago. This happens routinely all over the place, all over the country. Give me some more examples. New York Medicaid, at least $10 billion of that program in one state in 1 year can't be explained. It's just completely insane. The accounting practices in most state Medicaid programs make Enron look like a lemonade stand.
How does this happen?
Because there's no sunlight on the program. Nobody knows where these dollars go. Taxpayers, these people at Tea Party should demand more transparency. They're not getting it. It's completely and totally outrageous, and it literally is 1,000 times worse than you can imagine.
Give me another example.
There was a guy, this was last month, convicted murderer in Miami, who became a Medicare supplier. He had spent 14 years in prison, bought a Medicare supply company. He defrauded Medicare instantly, committed another murder and dismembered the guy, pled guilty to Medicare fraud in federal court 3 weeks ago, and is now also on trial in state court for committing a second murder. These are the kind of people that Medicare lets work for them.
What is the, so what do we do? I mean, we hear that, at least the president's program is that if we can figure out this fraud, if we can at least sort of recapture it, that'll in many ways pay down this health care bill. What do you suggest?
Well, I'll tell you, I give the president a lot of credit for raising the issue last week because he's right. And the amounts of money are just absolutely staggering, but he would have to be very serious and offend a lot of people in order to get the savings he talks about, but it is possible.
Offend who?
Well, I'll tell you, one example is to sell, the scooter commercials you see all night? Those kind of things are just rife for fraud. What they should do is, it's impossible to ever fix the people that run Medicare. So what they should do is outsource the authentication of new Medicare suppliers to Visa, MasterCard, American Express, because they actually know what they're doing. The people in Medicare, the culture is completely corrupt, they are totally incompetent, and they have no business running a program that elderly and poor people depend on.
Are there certain pockets of the country that are having seen more fraud than others?
Absolutely. Miami is a hot spot. New York is terrible. The former Inspector General in New York a few years ago said that up to 40% of claims in that state are questionable. That would be close to $20 billion in one state in 1 year.
If it's as bad as it's stunning to me that people weren't aware of it, and that and just simply, they had to have been aware of it, and they simply looked the other way.
They're either not aware of it, or somehow they're in on it. But the amounts truly are far beyond what you can possibly imagine, and it is in the hundreds of billions of dollars a year.
How certain are you?
Very certain. In fact, Malcolm Sparrow, who's a Harvard researcher who's been on this stuff for years, said he thinks between 20, 30, 35% of these programs are just flat out fraud. And the OIG, the Inspector General, 3 weeks ago released a report where they said they don't even have the capability of measuring how bad the fraud is. You don't see that in any other industry except for healthcare. It is just off the charts.
It's just terrible. Well, Stop Paying the Crooks is the name of the book, and it's a good idea. Anyway, it's stunning. Anyway, Jim, thank you. Up next.